Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more. Hello and welcome to the ABMP Podcast. I'm Kristin Coverly, massage therapist, educator, and as Director of Professional Education for ABMP, I create CE courses and events for massage and bodywork practitioners. And I have the opportunity to host this podcast and create what I call ComplePods. I pick a theme and ask several leaders in our profession to share their thoughts. Same questions, different answers, which gives us a compilation of thoughts, ideas, and inspiration. I spoke with Allison Denney and Dr. Joe Muscolino for this episode, both CE providers I'm lucky enough to work with to create courses for the ABMP Education Center. I asked my guests two questions for this ComplePod. The first is, what lesson did you learn from a memorable or impactful client experience? Because I think we're constantly surrounded by lessons, and our work with clients is a lesson-rich experience if we allow it to be. And I love to talk with other practitioners about how our work has impacted our lives. So this is one of my favorite questions. And my second ComplePod question is, how do you recognize and celebrate your victories? Because while I was planning this podcast, my nephew and his fiancée, my new wonderful niece-in-law, were getting married, which of course is definitely something to celebrate. And then while I was in the process of recording the podcast, my stepdad passed away. These experiences happening so close together reminded me that life is full of beginnings and endings and reinforced for me the importance of celebrating all of our victories, big and small, along the way. So let's do that. But first, memorable client stories and the lessons they taught us. My first guest is Allison Denney, practitioner, educator, and provider of continuing education and body butter products at Rebel Massage. Allison, tell us about a memorable or impactful client experience and the lesson it taught you.
Kristin, this is a phenomenal question, and it definitely sent me down memory lane, and I had so much fun thinking about all of my previous clients and where I've worked and all my experiences. So thank you for asking this question. This has been really fun to think about. But I think I landed on, there was lots of lessons learned, lots of amazing experiences. But I think I landed on the one that was most powerful for me was a doctor who came into my practice when I still had a private practice in Boulder, Colorado. And he was referred to me, and I believe he was a neurosurgeon. And I was so nervous. So I was fresh out of school. I was brand new, and I felt very underprepared. I felt like he knew everything and I knew nothing. And I felt like there was just such a big, huge gap, and I wanted to do amazing things. And I just was very, very nervous. And so halfway through, he not confronted, but he acknowledged that I felt nervous. He could feel it. And I said something like, I just feel like there's so much, and I feel worried that, I'm just going to do something wrong, or you're going to understand something that I'm doing that is not correct or right or something. And he was like, let me stop you there. Let me just tell you that what you do is so much more than I can understand. And how you work is so much more than what I do on so many different levels that I want to invite you to just sit in that and understand that we all have our specialties and we all have our talents. And I couldn't come close to doing what you do. And I was like, that was like the biggest gift. Like that sat inside of my heart and helped me formulate confidence that I honestly think has stuck with me for decades. We all struggle with confidence. We all struggle with imposter syndrome. And I think that having that voice in my head constantly of, it's not linear, and it's not a competition, and it's not something we need to be comparing ourselves to other people all the time. Having that constantly in the back of my head that we all have our things, even if I have, 1 year of schooling and he has 20 years of schooling, it doesn't mean that he or she is better than me or I am lesser than. It doesn't mean anything. We all have our gifts and our skills, and that's a really beautiful thought to rest on. Even to this day, when I had this memory pop up for me after you asked this question, I was like, oh, what a nice, kind man to say that to me, and to not be on a pedestal or to not create this gap between who he was or he is and who I am. And oh my gosh, what a gift. Totally.
What great reminders to all of us that it's not a competition and to be generous and kind to others whenever you have the chance. My next guest is Dr. Joe Muscolino, educator, author, and CE provider with Learn Muscles Continuing Education. Dr. Joe, tell us about a memorable client story and the lesson it taught you.
Okay, I've been in practice a very long time, so I could think of a number of them, but one stands out, and that is a young woman came in. She was a yoga instructor, and she started having pain when performing yoga. If she put any weight bearing onto one of her hands, her right hand, she had immediate pain in the hand that was extremely strong. So she could no longer do even a simple asana like downward dog. She could not put pressure on her hand. And she paid the rent and the car bill, the electricity, etc., by teaching yoga. So this was not very good for her in her situation. In the advanced classes, she could find someone and say, Mary, will you demonstrate this for us? But a lot of classes, she had to cancel. And she went to a massage therapist first, who palpated around her shoulder and said, oh, you have trigger points in your shoulder area, and they're referring down to the hand. That's why you have the pain in the hand. So she got a few massages, and her shoulders felt better, but it didn't change the pain in the palm of her hand, which is where she had it. And then she went to a chiropractic physician who palpated her neck, motion palpated, and said, oh, you have subluxations, joint dysfunction, and that's pressing on nerves, which is causing the problem in your hand. So we'll adjust your neck and your hand will get better. And she went a few times and her neck felt better, but it didn't change her hand. Then she went to an orthopedic surgeon that specialized in hand surgery, and he did a film of her hand and said, oh, the spacing you have in your saddle joint of your thumb is too much space, and we need to do surgery and shorten, sheath the ligaments and reconnect them, and that will increase stabilization and get rid of the pain in your hand. She did not do that. At that point, she happened to be in Manhattan taking an anatomy for yoga class, and the fellow who runs the class said, well, the guy whose book we use lives kind of between where we are now in New York City and where you live in upstate New York. You could just swing a little over to the right, to the east, and to Connecticut and see him. So she set up an appointment to see me, and she came in, and I do very thorough history and exams. I set up 2 hours for a first visit, figuring that history and exam will be about an hour, hour 15, and the rest of the time treatment. And I did an extremely thorough history, everything from pinched nerve up on the neck all the way down through thoracic outlet syndrome and pronator teres syndrome and carpal tunnel syndrome and into the hand itself. And I worked my way from up to down. And I was so thorough because I had 3 other professionals that had not found the solution, and professions whom I respect in their given circumstances. And in the end, I got to her hand and I pressed right where she said the pain was. And the pain was right between the second and third metacarpals, close to the second metacarpal on the palmar side. And when I pressed there, she said, "That's it. That's what's been hurting me." And I pressed that 12 different ways, being incredulous that it could be that simple, that where the pain was is where the problem was, and that a chiropractic physician, an orthopedic surgeon, and a massage therapist all missed it. And I spent all 2 hours doing history and exam, and she set up to come back 2 days later. And she came back in 2 days later and she said, "I'm about 30% better." Just because I pressed on it so many ways, the palpation assessment put force into the musculature, it was massage force, and it helped make it better. Assessment can be treatment. And I treated her only about 3 or 4 more times, and she was 100% better, and all better. And I can take a number of lessons from this. The first lesson is I never listened to an assessment diagnosis from another professional. The second one is always put out the fire wherever they're complaining of, even if it is a compensation from somewhere else. Once somewhere tightens up, neural facilitation things tend to cycle and stay tight, and it becomes its own problem. A third one is that of all these, and here's a massage broadcast, I blame the massage therapist the most, because the massage therapist should have found a tight muscle. I can understand chiropractic and orthopedic physicians being so locked into their mindset that they would want to go, as the saying goes, if all you have is a hammer, everything looks like a nail. But the massage therapist should have found it. And the next lesson there is most curricula do not teach intrinsic muscles of the hand or feet. They run out of time, and then they just kind of leave it. And as a result, and I teach workshops all around the country and the world, I can have massage therapists that are out for 3 months and out for 30 years, and they usually don't go back afterwards. They might do continuing ed for wonderful treatment techniques, et cetera, but they don't go back for fundamental anatomy, physiology, structure, function. And therefore, they don't know that area well. And therefore, they're hesitant to kind of go in there. And it was simply her first palmar interosseous muscle. I've been in practice now 40 years. Only once has the first palmar interosseous muscle ever mattered. But for that patient, that client of mine, it was 100% of her problem, and it made the difference between not being able to put food on the table and being able to put food on the table. So every square millimeter of myofascial tissue in the human body is important. And even the things that we think, how well do you know the omohyoid or the dorsal interossei pedis, or pick any other, seemingly obscure muscle. And I did an article for ABMP that was called The Unlikely Suspects, choosing some muscles that are not that well known, but sometimes they crop up and they're the problem. So to me, it's having the biggest lesson is having a very thorough, fundamental knowledge of anatomy, structure, so you can figure out your physiology function, so you can figure out your pathophysiology, so you can figure out your assessment, so you can then creatively employ your treatment techniques by critically reasoning from that knowledge of anatomy.
I love how Dr. Joe's example so clearly illustrates that one client session and experience can lead to multiple lessons. And special shout out to the first palmar interosseous muscle. So we've just heard 2 radically different examples of lessons from clients. And I could talk with you for hours about the lessons I've learned from client sessions, good and bad, because of course you learn from both ends of the spectrum and honestly everything in the middle too. But since I don't have hours to talk to you today, I created 5 general categories that I think reflect the wide span of life lessons we receive through our work. So There are obviously more than this, but I think these 5 cover the highlights. Communicate, set boundaries, learn, adapt, and be present. Let's start with communicate. I've shared several client stories on previous podcast episodes, and an overarching theme for all of them under lessons learned has to do with communication. Don't make decisions for this session in a bubble. Communicate your goals, intentions, and plans with your client. Keep them in the loop. I learned this lesson the hard way when, as a new practitioner, I thought I was doing something really wonderful by giving a client extra time. But since I did not communicate that clearly, I actually ended up causing my client stress because she had another appointment to get to right after the session. Another thought on communicating. While you're communicating your intentions for the session, which let's make sure we always do that, wrap that into educating your client about why you're doing what you're doing. So make sure your client understands, for example, why working on the anterior body and pec muscles specifically potentially help with the tension and pain they're feeling in their back. My clients have really embraced this concept. They are all on board, and it's really ignited for them a new interest in self-care and stretching between sessions because they understand the why behind the what to do. And they're coming in with showing me new pec stretches, and they're just really excited about it. They're taking an interest in their own wellness, and that's what we all want. Sessions are so much more satisfying and richer and full when it's a true collaboration, which leads me to my next category, which is satisfying in a different way, and that's set boundaries. This includes everything from setting your schedule and sticking to it, which as a new practitioner was challenging for me, to saying no clearly and loudly when a client asked me to commit insurance fraud and lie to their insurance company about the number of sessions they'd received from me. True story, unfortunately. Being a successful business owner means knowing, communicating, and maintaining your boundaries, even when that's hard. Next is learn. Sadly, you'll never know everything, and our work requires us to be open to constant learning, studying, and making the decision to refer to another practitioner when it's best for the client. When my long-term client had knee surgery, I refreshed my knowledge of post-surgical work and scar tissue management. When a client wanted hot stone massage after I stopped practicing it, it was not a fit for me, I referred her to a colleague who loved offering the modality. And in that scenario, all 3 of us were happy. So again, be open to learning, growing, and referring when you need to. That leads us to adapt. We are constantly adapting as humans and as practitioners. Every time a client comes in, they need something slightly or dramatically different physically and emotionally, and it's our job to recognize and respond to what they need in the moment. For example, a client I've worked with for over 20 years unfortunately experienced the loss of her husband, and of course, how she responded emotionally to the work during the sessions shifted, but she also began holding her body differently. Her posture changed. Where she held her stress changed. How much stress she was holding definitely increased and changed. And that changed the physical treatment plan for our sessions. So I have thousands of examples of how we need to adapt as practitioners because we're called on to adapt every day in every session. And that was just one example. From session to session, we shifted and adapted and changed, and we were just in the moment with what she needed. And that leads us to, finally, be present. To me, this is the most important category of all of them. It supersedes and encompasses everything else. Can it do both of those things at the same time? Supersede and encompass? I'm not technically sure, but I'm saying yes. So superseding and encompassing everything else is be present. Be present and be open to learn the lessons that are being presented to you. Start each day and each session with an open mind and curious spirit and see where it takes you. I'm so grateful to be able to do this work, and I hope that you are too. I encourage you to take some time to reflect on the lessons you've learned from your client experiences. It's a fun and very fulfilling practice. And now let's find out how my guests recognize and celebrate their victories. Dr. Joe, tell us, how do you celebrate your victories?
First way is I feel personally very good. I'm in this field to help people. I feel very good when someone gets better, whether we say I got them better or we facilitated the healing process, whichever way you want to look at it. We can be a part of that process, and that is incredibly important, and it is incredibly gratifying. The second way is my wife is in the health field. She's a Pilates instructor, a Feldenkrais practitioner, and a massage therapist. And I can chat with her and she can chat with me about the people that we help, and we can share that together. The third way is I teach workshops, and when I'm teaching the upper extremity workshop, or really any workshop of the body, but especially upper extremity, I can bring an example, a case study like this to show the power that we have. But I just want to add the other side of the coin, and that is that if you've been in practice long enough, you will have success stories that will seem like miracle cases. And I always find it I'm not a fan of when I go to a continuing ed workshop and the instructor leading it and teaching their technique, etc., only talk about their miracle success stories, because then that makes the participants, the massage therapist in the workshop, believe that every time they put their hands on someone, there should be a miracle success story, because that's all they pretty much tell. So I always have a certain trepidation with a miracle success story, because first of all, if that patient refers in a friend, that friend's going to expect a miracle success story. And I've had that happen actually to the point once where the person said to me, well, I don't know what you did for so-and-so, but you're sure not doing that for me, and canceled out. And I don't want the workshop participants to think they're all that way. So I like to pepper in what I call the meat and potato cases that are just chipping away at a problem, and some of the cases where I made an error and I just misjudged how to assess or how to work on someone. So I definitely do celebrate these success stories, but I try not to let them become the overriding story arc for how manual therapy is done.
Dr. Joe answered the question from a bodywork specific point of view, while Allison answered from a broader perspective. Let's listen to what she has to say. Allison, I'm going to ask you a two-parter question. My original question was, how do you celebrate your victories? But you reminded me of the importance of first recognizing your victories, which so many of us don't do. So, two-parter question to you. First, how do you recognize your victories? And second, how do you celebrate them?
Such a good question. And I don't even know that I have a concrete answer. I mean, I think the ability to recognize a victory is in and of itself something that I feel like is a victory. I mean, I think that being able to acknowledge my own competence is a really refined skill for me. I've had to work really hard at it. I've had to acknowledge that if somebody compliments me, I can say thank you and not, oh, no, I'm not that, or this not right, or you. I think that being able to recognize a compliment is recognizing a victory in and of itself for me. I think that just sitting in a space of feeling like I am good and I can do what I do well really gives me a sense of happiness and wellness and purpose that I think is better than any prize or piece of cake or beer or whatever all the other things we use to celebrate might be. And then I guess the second part, just how do I celebrate? I mean, yeah, I think like a beer or a burger or a piece of cake or some ice cream. Just a little treat every now and then, because that's nice.
I love that Allison referred to recognizing her victories as a skill, because it is. We have to train ourselves to do it well. And how do we do that? Well, this is my thought. Set goals, track your progress at regular intervals, and acknowledge and celebrate your wins with something that brings you joy. And that's personal. It should be absolutely unique to you. I like to buy new watercolor paints to celebrate. And most importantly, I make sure that I share the victory with someone important in my life, whether that's going on a walk and talk to discuss it or getting together for a meal, whatever that might be. It's taken me a really long time to realize and get comfortable with the fact that sharing your joy makes it that much sweeter. Thank you for sharing this time with me. I hope this CompoPod has given you some inspiration and has encouraged you to reflect on both the lessons you've learned from client experiences and how you choose to celebrate your victories. Please share your thoughts and ideas and victories with me by emailing me at CE, that stands for Continuing Education, CE@abmp.com. Thanks for listening and have a beautiful day.